began planning for the time that this virus would hit our community. That time is now. Our logistics staff began ordering additional personal protective equipment such as Tyvek suits, N95 masks, surgical masks, gloves, and eye protection to ensure that we would have enough stock to be able to respond to this pandemic. We found other avenues as well to continue to procure that critical equipment, including working with the EOC to make orders through the state. Our goal is to ensure that we have an uninterrupted supply chain for that. We've also developed a modified and flexible incident action plan that includes many levels that may be implemented and grow and retract as the pandemic escalates and moves through our community. The other fire service agencies for which we provide dispatch services have agreed to work within the guidelines that KCFD is using so that we're all working on the same path and making the same responses and the same modifications to our response plans as well. So we've continuously worked with Mark's Regional Homeland Security Coordinating Committee, our hospital partners, other agencies throughout the region so that we are all on a coordinated response path. Many years of active collaborative efforts between those partners, emergency medical service, hospitals, emergency management, law enforcement, and fire service communities has lent the entire Kansas City region the breadth and depth to be able to respond to anything, all disasters, including this COVID-19 pandemic. The regional response will continue to be addressed in the same coordinated and professional manner. The Kansas City, Missouri Fire Department is prepared to respond to all calls for service in the same professionally trained, caring, and safe manner as always, and as is expected by our community. Our priority is to fulfill our mission while protecting our first responders. We work closely with Dr. Erica Carney, our medical director, and the public health director, Dr. Rex Archer, so that we ensure that we're working off the latest guidance and guidelines. We've also benefited greatly from ongoing information from lessons learned from other EMS and fire service agencies that are on the front lines of this pandemic, specifically from the Washington area and Seattle area, where these outbreaks have already been experienced, and they've been able to adapt our information, or we've been able to adapt their information in our preparation to respond to this pandemic. Chief Smith and I are in direct contact. We're working together to ensure that his police officers and our firefighters and EMS responders are reducing their risk of exposure in every way possible. KCFD is working within the guidelines of the mayor's stay-at-home order to modify elements of our operation to encourage community compliance and to ensure that personnel are available to meet community needs under a variety of contingencies. Modifications have included reducing our fire inspections to an as-needed basis, changing the way we provide smoke detectors by, people can still call in to ask and request smoke detectors, but instead of installing them, we'll be happy to deliver them and leave them on their front porch, and suspending all of our community outreach activities. Generally, our fire stations and other facilities are closed to the public and closed to visitors. As a Kansas Citian, you can help us adhering to the mayor's stay-at-home order. You can also help protect the 911 system, ensure that our responders are available for emergency response, and prevent emergency room congestion by contacting your primary care physician first or nurse care line if you have any mild flu-like symptoms, shortness of breath, unexplained cough, or a mild fever. Your doctor can review those risk factors with you, review the symptoms, and answer any questions or concerns you may have. However, I want everybody to be rest assured that KCFD is ready and prepared to respond to this pandemic. We're taking all necessary measures to ensure our workforce stays healthy and that we respond using the latest guidelines from the CDC and National Fire Service organizations to keep our community protected while we continue to protect our first responders. Our mission and current priority is always to provide emergency medical service, fire suppression, technical rescue, and hazardous materials response to our residents, visitors, and community. While protecting our responders, the public and property is a key component. In the face of this pandemic, we are making ever-changing updates to that mission. So, thank you. We'll turn it over to Chief Smith.
Thank you. I'm Rick Smith. Thanks, Donna, and thanks, Jim. First and foremost, I think it's important that we all are here today to show the coordination and the lines of communication are open and being used frequently between fire, police, emergency operations, the state, all types of entities. Earlier today, I was on the phone with chiefs from Overland Park, KCK, Lee Summit, Independence, the SAC of the FBI, ATF, DEA, Homeland Security. I've also talked to the chiefs of Liberty, Riverside, Gladstone this afternoon. So I want people to be assured that we're talking and we're making sure each other's organization is making the proper plans to handle the situation at hand. As Captain Jackson said, we've gotten a lot of questions lately, especially with the stay-at-home order, and we wanted to share some of those answers to get some of those questions out to the public and get them answered. First, I want to say this is new to us too, right? The police department has never worked through an epidemic like this before in my career. We're dealing with a lot of the same challenges that everyone else is. Kids at home, having enough supplies for our families. The situation is changing daily, and we are doing everything we can to adapt to that. Our primary concern, as it always has been, is the safety of our city. So many of the things I'm going to discuss today will explain how we're continuing to work at keeping people safe in an unprecedented situation. So the first question, how will you be enforcing the stay-at-home order? The enforcement of this order really doesn't fall under the police department, first of all. It will be more up to city entities like the fire marshal. Chief Mays can talk about that more if you have a question. Other entities, regulated industries, things like that. We will not be stopping people to ask for papers if they're going to work, or stopping cars and asking them where they're going and how they're getting there. I think what everyone needs to realize here is the order is in place that we try and stop the spread of a virus. What we're asking people to have is some civic responsibility, not being based on enforcement. Whom should we call if we see a violation of the stay-at-home order? Unless there's a criminal element, we ask all people to call 311, not 911. We need to keep the 911 system open for emergencies. Reports such as these can go through the city and can be dealt with by the regulatory agency as they come up. Are you changing any of your enforcement practices? We will continue to ensure the city remains safe and responsive to calls for service. At this point, we are responding to calls for service like we always have. There's some minor adjustments on calls that maybe can be handled over the phone or can be handled outside, things of that nature. We're also doing proactive traffic enforcement when the need arises. What we've told our people is to weigh the risk versus reward. We know that we're not out probably stopping cars like we have in the past, but we also know that we have to maintain public safety. And this excuse me, and we don't want it to become a free-for-all out there. So if people are taking advantage of the situation, there's a good chance they could get pulled over. Sorry. Are you doing anything different in your jails? KCPD only operates temporary holding cells where arrestees are detained before either bonding out or going to the county detention center. We have been implementing stricter health screenings in our detention units, but they will continue to operate as they have been. Officers have and have always had the discretion of whether to take someone to jail in most cases. To that extent, we can keep people out of jail without posing a threat to the community's safety, we will. Is the National Guard coming to institute martial law? The Missouri National Guard has publicly stated this is not happening. I know that's a fear of a lot of people, that in situations like this, the government's going to take control of everything. Again, back to the point, we're asking for people to have some personal responsibility to stop the spread of the virus. And that's what we want to communicate today. Have you spoken to the governor? I have. I spoke to the governor at City Hall. We had a nice conversation when he was here doing briefings from around the state and wanted to see if we needed anything, and we had a nice chat with the governor. How are you handling the homeless? We will continue to work with them as we always have. I know the social service agencies that assist the homeless are really overwhelmed right now, but questions about assistance to homeless should be directed to those agencies. Our social workers will continue to operate and are in discussions today about the best way they can safely serve the community during the stay-at-home order. So we're working through that. What kind of scams are you hearing about? Well, it might be easier to say what kind of scams are we not hearing about. I think people need to be very careful about getting involved in things, especially the FBI is concerned about some cyber attacks during this time. I think it's really, people should be cautious, and if they have questions, they should ask. Businesses, of course, that are shady are referred to the Missouri Attorney General's office. That's a good place to start if you have a question. Are calls for service going up? What about domestic violence calls? We seem to get this question quite a bit. It's really too early to tell at this point. Our priority 1 and priority 2 calls, our most important calls for service last week, were down 4% and 3.5% respectively compared to the same time last week. Or the week before, pardon me. If you're in a home and you don't feel safe on domestic violence, we're asking you to call the hotline, 816 hotline. If there's a true criminal element to it, call 911 and we will respond. What are you doing to keep officers safe? Do they have the equipment they need? We are working with our local and federal partners through the Office of Emergency Management to procure the personal protective equipment officers will need. The officers have all been issued PPE equipment, just so we're on the same page there. What we're talking about here is the disposable masks mainly and that kind of equipment. In the meantime, working tirelessly to provide sanitation supplies to our members. Businesses have stepped up to help, doing everything from hand sanitizer to food, and I can't say how much we appreciate the community's outpour for that. That leads me to the final question. How can people help the KCPD right now? We are asking for donations of temporal scanner thermometers. We don't have enough. We would like to have those for not only our own employees, but some of the people we're coming into contact with. So if anyone has that extra, we're asking for extra here. We're not asking for people to go without. We would happily take that donation at any of the patrol divisions. We're looking for about 10 of them. The other thing we're asking for is masks. If anyone has extra masks, we're not asking for their mask. If anyone has extra masks, we would take those even if they're handmade. We can put them over another mask and we can use our disposable masks longer. Okay, I think we're ready for questions if anyone wants to start.
I'm going to start with the enforcement action. The stay-at-home order has been issued. What should people expect when it comes to enforcement? We're trying to get a clear answer on if there is going to be any kind of enforcement or if it's just sort of an honor system.
Well, I think, Matt, in my opinion, Matt, what we're asking people to do is do the right thing first, right? If we run into an issue where we think public safety is in jeopardy and it's violating the order, then the police department may get engaged. But just for normal people who are going to the grocery store, going to the pharmacy, I think what we're asking you to do is do your business and return home. I think that's what the order is specifically saying. That's what's requested of us.
Can you explain the difference between like a stay-at-home order and a mandatory quarantine and martial law? Because I think people don't really know what stay-at-home order means.
Yeah, I think, again, it means just stay at home. We're asking you to stay at home. When you're not at one of the stores or doing some necessity, getting medicine, doing that sort of thing, if you have a job that's non-essential, that you stay home. I think that's the ask here. I think it can move into other things, a quarantine situation. If someone's refusing and we know they're diagnosed, things like that could move in that direction. Of course, like I say, we're all in this together, people. It's all of our community. What we're asking people to be is responsible. That's what we're asking.
Can we ask you about officer safety a little bit? You're asking for thermometers, for masks. Do your officers have what they need right now if you're asking for donations?
We have some, but it's limited. I will tell you, it's very limited. And this is not just a KCPD issue. This is a nationwide issue. But yes, we have some, but would we like to have more on hand? Absolutely. And like we mentioned earlier, some of our community members have been so gracious and helped us with supplies and have stepped up and said, hey, if the police department needs this, we're here. And we've been very thankful for those people in our community who have helped us and get us, honestly, a lot of the supplies we're using today, right now in our police cars, every minute has been donated material.
There have been so many situations in other cities. In Detroit, I know that there were 152 officers that were quarantined because 5 of their officers tested positive. what are you guys doing to kind of protect your guys extra? And what are they being told if they're not feeling well?
Yeah, so every day we send out reminders. Everyone's getting an email every day that says, hey, use gel after every contact, clean your uniforms, whatever the tip of the day is, we're sending it out every day, a tip to our workforce to try and keep them healthy. We've provided supplies to say, hey, I want you to wipe down your car, I want you to wipe down your workspace, whatever we need to do, we're trying to do that. I mean, we have no magic formula any more than any of you do. We have the same rules and been given the same directions that everyone else has. And I'm telling you that at some points, when we make contact with people, there's a risk there, right? We're asking people to stay 6 feet back. We're asking people to come out of their house on a call if they can. We're trying to do business differently to prevent or lower our exposure risk.
Are social workers going to continue their work in the community, and if so, is that being modified at all?
As much as possible. I mean, we're trying to line some things up with them. But, if there is a contact, we're asking them to do the same thing we're asking, the social distancing and all of that.
Chief, how does that affect your dispatchers and call takers?
Yeah, that's...
Stressful job already, then add to this.
It's a great point, Glenn, and I would say it's one of our biggest concerns, right? We have a call center where people are pretty well fixed into a technology that has to be done in that room, that cannot be done at home or anywhere else. So we are taking some preventive measures there, a little more so than we are even in some other places of the department, to try and keep that staff as healthy as possible.
You talked about enforcement of the stay-at-home order. You're not going to be pulling people over and all that kind of stuff. But how, if people aren't following it, what does that enforcement look like?
Yeah, I don't know what that means. I mean, there's a whole street of people driving right there on Independence Avenue that I can see. I don't know who's essential and who's not. So to your point, and maybe to others, it's back to, hey, we want you to act responsibly. That's what we're asking. Now, I said it may change if we know there's a known exposure and someone has that and someone's not listening. Things could change and go in different direction. But at this time, I think what we all want to do here is stop the spread, right? They talk about flattening the curve, making it safer for all of us as a community. If all of us do that together, the chances of us getting out on the other side of this be quicker and less damage done. So I hope that our community will be one of those communities that wants to do the right thing.
How does this affect academy classes? I know that's pretty close to quarters, and those guys, you've done some stuff with them, got running, and
Yeah.
how does this affect that?
It does affect it. So right now, we have 2 academy classes, our academy. We have one that's about 30 days from graduation. We are doing everything we can. We've shortened the amount of time a little bit. We've cut some classes, and I mean our classes here and there, shortened some time. We're trying to get to 2 weeks shorter, try and get them out sooner so we can get the other class in the academy by themselves. So we're talking about that and options with that. The fact of the matter is we need cops, and the only way to get them out is to get them trained. So we've done social distancing in the classroom. We're trying to provide some other opportunities where they're not together all the time. But it is a hard situation, Mike. It's, we're doing the best we can.
Maybe this is more a question for regulated industries or maybe somebody else, but small businesses. I mean, we talked about personal enforcement, but what about small businesses who may not be essential? What if they might violate this stay-at-home order? How would you enforce that?
I think for the fire department, of course, the only enforcement avenue that we have is through our inspectors and through occupancy levels. And so I think it would be kind of like Chief Smith said, if somebody notices a business that is open and more like restaurants, bars, taverns, those sorts of things, and the fire department's not going to make a determination of whether it's an essential or non-essential business, but what we would do is, if it was reported through the 311 system, information would come to us, and then we'd send an inspector out to see if they were at occupancy open and what their occupancy level was. But as far as that, then it would just be a conversation with the manager or whatever. for regulated industries, I don't want to speak for them, but, I think their enforcement actions typically are administrative in the sense that, again, they would be meeting with the business owner or managers and, whether or not that could affect their licensure in the future if they weren't taking adherence to those stay-at-home orders. That'd be a better question for regulated industries, so.
When you're talking about occupancy, is that the occupancy during a normal day or the occupancy of 10 people in one space?
Right now, with that order, we're going to look at 10 or under, and really what, the mayor has asked with his stay-at-home order is that, all of those businesses, and pretty much as far as restaurants, taverns, those sorts of businesses, they've really been gracious enough and worked really well with the city and partnered with the city and closed except for carry out and drive-through services. And so, we want to encourage all businesses and especially restaurants and bars and taverns and places where, people would gather more frequently. Like Chief Smith said, when, you have to go into a hardware store or a grocery store to go get something to either, make a repair at your house or whatever. I mean, those transactions, it's again, just adhering to the idea of when you're in there, social distance, stay back and space yourself when you're standing in line and then, get your business done and go back home. So, but really we've had really good luck across the city with our restaurants and other, those types of food service businesses closing. And of course, I think you've probably heard, I mean, obviously we've seen all reported, you guys have probably reported on it, the fact that, they have a lot of low-income employees, waitress staff and wait staff and servers and that sort of thing. And so I think they're looking for other ways to stay, one, in business and help their staff. So by going to the option of drive-through and that sort of thing, it's been helpful, so.
Chief Smith, one more question for you maybe. Where are you circling the wagons right now? Where is it, where's sort of the weakest link that you want to protect the most?
A communications unit?
Really?
Yeah, our communications unit, I think right now is one of our biggest concerns operationally.
Can you explain the importance of that, I guess, then? What happens if that goes down?
Well, it's not going to go down. It's, we have an alternate backup site, so we have the availability to move it if one were need to be cleaned while we're at another site. So we have some options, but it's just to keep the normalcy of the continuous operation going without the public knowing. And we want, or not without them knowing, but what I'm saying is we don't want the public at that end to feel any kind of stress at this end. When they call 911, we want the call answered just as efficiently as it has been. So to keep that going, that's one of our main priorities.
A year or two ago, you guys had you were looking for people to work in the communications unit, and there was a lack of employees there. Do you have enough employees there now that if somebody or a few get sick, that you'll be able to cover that?
We think so. I mean, obviously, that's why we're probably screening a little heavier in that unit. I mean, we don't want to allow, if there is an employee who we think is getting sick into that environment, we want to prevent that from happening. But let's face it, one of the worst things about the virus is no one knows really when you have it, right? It's such a delay period of time, and that is the difficulty with this, right? If we knew instantly, it wouldn't be an issue. But, you can go up to 14 days. That's an issue. It's an issue for all of us, no matter if the screening happens right before work or if the screening happens the day before. That's not 14 days. So I think we're all under the exact same kind of challenge. Virus.
Are you in that department then?
No, we're not fully staffed.
Are you
We are actively training communications. Yes, we are.
And Chief, part of your conversation with other agencies, is there a conversation about shared resources and within that area?
Sure. Yes, we talked about that today on several of the phone calls. We'll talk again tomorrow at noon about, hey, law enforcement, whose agencies feeling stressed. We talked today about, does anyone have an active case? Does anyone need resources? How's your sick time looking? Just the basic operational things if we need to help one another out.
And that was with all the departments that you talked to, including like Overland Park.
That's correct.
State Line and
Yep, we all talked about what's our protocols. Is anyone doing anything much different than what we're doing? And just little things came up. Hey, we're asking shift before shift. Some of the other agencies, they're able to test their people mid-shift. We can't do that here. We don't have the resources. But, little ideas like that come up from every phone call.
any sorts of calls that maybe you would have, they would have gone right out on, officers would have gone right out on before that maybe now they're gonna ask people to?
Some of our property crimes, like I said, we're referring them back to just making phone reports. So most of those, that anything that we can, we're just saying call that in rather than have a response.
I know this might be redundant, and I apologize for asking this again if it is, but in the statute for the stay-at-home, it says that if you are caught violating it, let's say, you could be fined anywhere up to $500 and potentially spend time in jail. So can you just talk about that and if that would ever be enforced and what would be the conditions that it would be enforced to actually cite people and haul them off to jail?
Again, that's not our goal here, right? I understand that's what everyone's worried about because that was what was talked about. But I can only think of a condition where someone is, we know we have someone who's not obeying, someone walked out of a hospital, someone, is causing a public safety concern to others. Then I could see us getting engaged. But that engagement might be, hey, we want you to go home. It may not be an arrest. Hey, go home and self-quarantine. So it's just on the level and what happens, we take it on a case-by-case basis. Like I said, I'm hoping through these news conferences and the communications we have that people get from this, the sooner we get over this and the sooner we get on the other end, the sooner we all get back to normal. If we can just try and show everybody that we can do something for everybody else and just relax a little bit, stay at home, watch your Netflix, and let's not try and spread the virus. That's what this is all about.
So masks and temporal thermometers, are those for, you just would like to have each officer be able to have one on them? Would that be for the community? Or
Actually, we just want them at the stations. We want them at the stations for the officers. So before shift, during shift, if they felt bad, they could take their temperature. I don't want you, I'll break, but I don't want anyone to feel if they don't have a question. I want the public to know that we're together and we're working together and all our agencies are working together. I'm sure everyone is stressed about what could happen out there. I know people are very stressed. They're asking all kinds of questions. Today I'm listening to radio and someone's on the radio talking about you got to have a piece of paper and you don't have to have any of that. I just want people to know public safety is here to assist. We are here to try and help people. We want to get through this on the other end. That's what we're here for. We want a safe city just like everyone else does. I'm sure no one else out there wants to get sick. We don't either.
Anybody have anything else?
I just have, and I don't know if you have a different answer than what you said before, Chief Mays, but it was said in the beginning that the fire marshal and regulated industries are really the people who are going to be enforcing the stay-at-home order.
Well, yes. I don't know that enforcement, I think it's a matter of if it's reported, by a citizen or resident through 311 that there's a business that's open that shouldn't be open. I think the first line would be 311 identifying whether or not it's an essential or non-essential business and or if it's a restaurant or that sort of thing. I think the only thing that our fire inspectors would be doing is going in and checking to see, one, in fact, if they are open, and two, what their if their occupancy is exceeding 10, and especially if it's a restaurant or a bar or tavern, that sort of location. I think that obviously we've had really good assistance with that industry on closing. Other businesses, it's not for us to determine what's an essential or non-essential business. I don't know what regulated industries intends to do, but as far as the fire prevention and fire marshal's office, it would only be about occupancy and adhering to that 10 or fewer people, in the sense that it's a normal, a business like a grocery store or one of those essential businesses, then no, we wouldn't be looking to say they could only have 10 people in at a time. So. Mm-hmm.
Does anybody have anything else? Thank you, guys. Have a good day.
appreciate it.
Was it helpful?
Yeah.
Yeah, very,
Very
very.
good. Thank you.